Hi, my name is Matt Cathell with Bear Health and Fitness. We're offering a postural correction specialist certification. It is a 56-hour course. It's broken up into 7 pieces. Each course is 8 hours. I began teaching this course in 1991. I've been in the fitness industry for over 25 years. I first got in the industry mainly because I was curious about different types of therapy and exercise and how to combine them together. In 1991, I began working with the Egoscue method in San Diego and learned the techniques of basic postural correction. And with that, different experiences, strength and conditioning coach, working with different companies, running safety programs, and teaching around the United States, working with different companies around the United States, some of the Fortune 500 companies, and finding what techniques work the best for mitigating injuries, for preventing injuries, for building professional athletes. I came up with a group of exercises and techniques that best fits not only for physical therapists, occupational therapists, but also for personal trainers and other allied health field, chiropractors, medical doctors. The course is really specifically built for physical therapists, occupational therapists, athletic trainers, and personal trainers, because we're really dealing with exercise. And so what I've found over the years in creating this program is that most people don't deal with preventative injury fitness. They don't look at the body in a preventative way. Most people, especially in the medical industry, look at it in an acute way or deal with the body in an acute way. And so, in having said that, I wanted to come up with a way of how do we come up with exercises and assessment techniques that we can prevent the problems from happening in the first place. How do we create a program to best get our clients fit, healthy, and get there safely? How can we do that? As opposed to using the old techniques of going from large to small muscles, I created a way to evaluate the body in such a way to pick out the most important parts that are faulty with it, and then learn to analyze that information and then convert that into an exercise program on every level, not just stretches or stuff like that, but strengthening exercises, aerobic exercises, plyometrics, whatever it might be, or even rehab scenario. And so what you'll find in this postural correction specialist program certification is that it gives you all the tools that you'll need, not only for working with the average Joe, the average person that's just trying to get fit, lose a few pounds, but also gives you the tools to work with difficult rehab cases, post-surgical, people that are in a lot of pain, they have sciatic pain, or they have tennis elbow, they have thoracic outlet syndrome, TMJ, headaches, knee problems, hip problems, degeneration. We can deal with all that with this certification. Okay, so again, it gives you the evaluation, the assessment techniques through gait analysis, postural analysis, and then very specific techniques in exercise prescription, how to choose the exercises best to help eliminate any biomechanical issues that leads to faults that doesn't allow your clients to get to where they need to go quick. So you have to be able to evaluate the issues that your clients are having and then prescribe exercises according to that. And of course there are other things like blood labs, other conditions that a person might have, but one of the fundamental things that we all need, again, whether it's a physical therapist, OT, an AT, or a personal trainer, is we got to know what's going on with the client biomechanically. So you've got to be able to structurally analyze that person in great depth and understand what that means, and then be able to convert that into a program that makes sense, that follows specific scientific techniques. Okay, so the first course that we work with in the postural correction specialist is the fundamental one, and that's